What is gonadorelin used for? Now, these are great questions, and by the way, if you have questions, put them in the comments below, and we'd love to create videos around it. But gonadorelin, it wears a lot of hats. In the clinical setting, it can be used to diagnose whether you've got a hypothalamic pituitary axis dysfunction. It can treat a condition called hypogonadotropic hypogonadism and restore fertility. It can also be used right alongside of TRT to preserve testicular function. And it has great role in stopping certain hormone-sensitive conditions rather than creating this imbalance in the body because you're taking in exogenous hormones. Gonadotropin, how is it used? Well, context determines everything. And so gonadotropin, when it was first used clinically, this was in the 80s. It was given either intravenously or subcutaneously, and they found that it stimulated the pituitary to release luteinizing hormone and follicular stimulating hormone. And hypothetically, if the pituitary is functional, then you're going to see testosterone levels become functional, and you'll see your sexual capabilities restored. You'll see erectile quality improve. But this is done through this pulsatile mechanism. And so what they found in the studies, they found that luteinizing hormone after gonadorelin was either intravenously introduced or subcutaneously, about 45 minutes post-administration, there is a peak luteinizing hormone of roughly 9 to 10 milliliters per ml in a standard gonadorelin stimulation test, compared to higher peaks with longer acting agonists like triptorelin. What they found in this test is it distinguished between just the hypothalamic dysfunction, that would be low or absent gonadorelin or gonadotropin releasing hormone. The pituitary responded when stimulating, and the pituitary failure when the pituitary didn't respond even when you worked on this gonadotropin releasing hormone pathway. So there's two different types, but they also used it in boys who were not thriving during puberty, and there was like very low adaptation to growing pubic hair and actually having a change in reproductive growth of your reproductive system. And so the most well-established of gonadorelin is where men had the hypogonadotropic and hypogonadism. That's a condition where that signal from the brain is absent, and so that leads to low LH and low FSH and consequently low testosterone and impaired spermatogenesis. And what they found is just by using gonadotropin or gonadorelin therapy, they found that this was able to restore testosterone to normal ranges. It induced testicular and pineal growth. It allowed men to able to achieve ejaculation and increase their spermatogenesis in the majority of men treated. Now, most of the men who come into our office, they're somewhat worried about hypogonadism or when the testicles shrink, but really what they're looking for is they want to produce testosterone internally on their own. Many of these men, they realize, oh, I'm in my late 40s, I have a younger wife, and we want to start having kids, and I can't be on testosterone because it's turning off my sperm. Is there any other alternatives? And that's where gonadorelin can be very helpful. In fact, in one study, the fertility treatment group with the gonadotropic therapy, that would be gonadorelin, they found that pregnancy rates improved by 50 to 80% relative to placebo. They also found that for men on testosterone replacement therapy, gonadorelin, it's increasingly used for pituitary stimulation, and it slows down testicular atrophy because your TRT, what it's doing is suppressing luteinizing and follicular stimulating hormones, and when your testicles stop receiving that signal from the brain, they shrink, they lose Leydig cells and Satori cell mass, and it usually takes about 6 to 8 months on gonadorelin to fully get those re-engaged after testosterone stopped. If you think about how the exogenous administration works. It leads to pituitary desensitization if you're using it too frequently. And so this is where pulsatile administration is required, and this could be either daily as an oral, or you can do it like 2 or 3 times a week, whatever your provider determines. And so one of the things that we've realized is if we can get your blood work ran and your gut tests, there's this unique pathways that we want to look at. We want to look at LH, FSH, your total testosterone, your free testosterone, your sex hormone binding globulins. And then we want to look at your liver function, your cardiovascular function, because the thing that blocks testosterone that's not talked about is stress. And there's 4 stressors. It's not just the psychological stress. I know many of you are high performers, high achievers, and you've learned how to manage stress and how to achieve and accomplish a lot of different things in your life without feeling that anxiety that a lot of people would have. But the other stressors are the pain. A lot of you are, like me, are adrenaline junkies. You push yourself hard. You have injuries that you've had for years and ignored. And this is where stem cell therapy can be incredibly helpful. Even with low back pain, people's brains age 7 to 10 years faster than people without low back pain. And that pain in the brain, it turns down the signal for your body to make more testosterone. The other kind of stressor are infections. You can have infections from mycotoxins, from Lyme disease. You can have bacterial infections or parasitic infections. And especially if there's an infection in the gut, there's a pathway called your beta-glucuronidase pathway, and that's responsible for unconjugating hormones. And if you have hormones that aren't being broken down and they're being recycled, they are inactive hormones that are going to bind on the tissue sites where you want testosterone. Chemicals are the other stressor. Alcohol blocks testosterone production. Alcohol can also lead to blood sugar dysregulation and liver issues, which once again, then you're not breaking down the hormones, and so you have hormones that are bound to the tissue. Or you can have, most of us, we have plastics in our body. Those plastics and phthalates, they bind, they act as molecular mimicry. They bind to the receptors where you want the testosterone and your hormones to be. So looking at the underlying cause is a great way of starting when you're saying, well, is Gonadorelin something I should be on? Or even testosterone replacement therapy. You just want to look upstream and look at everything. Look, if you're looking for fertility, get your sperm count, your motility tested, your morphology. This is really important. And then looking at your blood labs, making sure you're testing all the things like your total testosterone, your free testosterone, your LH, your FSH, your estradiol, your sex hormone binding globulin or SHBG, your prolactin, your PSA, and then look at your liver function, kidneys. You want to have the raw material so you can make great hormones. And then if you're still not responsive, I can't tell you how devastating it's been where some of our men, we've sent them in for a brain MRI, and we found they have these little pituitary tumors. Usually they're benign, but those tumors are putting pressure on the pituitary gland and they're blocking the signal. Now, there's no easy fix to that, obviously, but if you fall into that camp and you're somebody who's had resistance to other treatments, then make sure you consider getting a scan done to see if there's not something else that's blocking it. Because what I've seen in your ageless axis in protecting your heart, your muscle, and your brain, testosterone is a crucial interplay between that entire axis. And if you can use something more natural like a peptide to turn this pathway on, that is where you can have the most robust health for your 88th decade, 9th decade, and hopefully past 100. And so if you want to go deeper, if you want to look into different aspects of why you're not feeling, looking, and performing your best, just go to agelessfuture.com, schedule your free intro call, and my team will take great care of you. They'll get the right test ordered. Once we have the test, then they'll put together very specific peptide protocols so that you don't have the overwhelm, you don't have to guess any longer. You can get answers and get clarity very quickly. I'm Regan Archibald. I'll see you on the next video.